Well, hello everyone, and welcome to the Business of Fear-Free, How to Positively Impact Profitability and Practice Value. I'm Christy Keith, Senior Communications Strategist for Fear-Free. And before I introduce our speaker, I'd like to quickly take care of a couple of housekeeping items. First, we'd like to thank our friends and Fear-Free sponsors at SIVA for making this webinar possible. And we'd also like to thank all of you for making time for this webinar today. We greatly appreciate your time during the workday in particular. For those of you who will undoubtedly want to share this with others, the recorded version will be available within a few days at fearfreepets.com/webinars. Dr. Hargrove will have time for questions at the end. Please ask them, however, as soon as they occur to you rather than hoarding them. We all know hoarding is bad. And ask them not in the chat window, but in the Q&A window. That would be really helpful to me. It's now my great pleasure to introduce our presenter. Dr. Michael Hargrove is the owner of a 7-doctor small animal practice in Duluth, Minnesota. His practice has been AHA certified for 41 years. Wow, congratulations. And in 2018, became the first Fear-Free certified practice in Minnesota. Congratulations on that too. Dr. Hargrove is a certified Fear-Free professional and is also certified in low stress handling and is a member of the Fear-Free advisory group. He also works with Summit Veterinary Advisors as a veterinary management consultant. He has an MBA and is a certified valuation analyst who works primarily with veterinarians who are buying and selling veterinary practices or are looking for more information on how to improve the financial health of their practice. Dr. Hargrove is married with 1 son and 3 stepsons, as well as 3 cats and a stepdog. I love that, so I left it in. Thank you for being with us today, Dr. Hargrove. I'll turn it over to you now.
All right, well, thank you very much. This is my first webinar presentation, so hopefully it'll go well. I'm not a huge public speaker, but I'm actually finding it a whole lot easier to speak to a room of 150 people than just speak to my computer screen because I can't see anybody's faces. So anyway, thank you for being here. I am trying to bring Fear-Free to people at the level of leadership and practice engagement. I think most of us on this call are Fear-Free professionals or are at least interested in Fear-Free enough to be here. I think it's pretty straightforward as to why Fear-Free is fantastic for our patients. But what I have found over the years that I've been involved is that there's been somewhat of a disconnect. I find that there's a tremendous amount of engagement and interest from our veterinary team, and yet that isn't being translated into people becoming Fear-Free certified or specifically practices becoming Fear-Free certified. Just to give you a quick example of that, we were, I live in a community of 100,000 people, and we have CE programs in the evening for our community like all of you do. Various vendors will come in and have a dinner and give us a 1 or 2 hour CE presentation. And after my practice had started doing Fear-Free, SIVA actually sponsored a Fear-Free talk in our area, an evening seminar. And normally our evening seminars bring maybe 30, 40, 50 people, depending on the topic. This seminar for Fear-Free, there were 150 people there. It just blew me away. The level of interest and engagement was outstanding. The presentation was outstanding. Every single one of the hospitals, not just in our city, but in our region, had representatives there, including a number of the practice owners. So that's just super exciting to me because I believe Fear-Free is something that should be that everyone should embrace, that it should be a standard of care in our industry. So the more we get people involved, the happier I am. But cut to 2 years later, in our community, my practice is Fear-Free certified. We have 33, certified individuals. There's another practice in town that also had been involved prior to that seminar, and they have about 12 people, and that's it. None of the other practices have fear-free certified professionals, and none of the other practices are fear-free certified. And I just have to wonder, why were there 150 people at that meeting? Why was there so much engagement and so much enthusiasm, and it didn't lead to anything? And so what concerns me is I feel like there is a problem at the highest levels of practices in terms of the financial aspects of it, the implementation in practices with practice owners, managers, veterinarians, because I find it's the staff that gets engaged and involved. But then if they aren't supported, if they have to foot the bill for everything, and then if they don't get the support within the practice to implement those changes, then it tends not to continue. And I've actually seen people leave practices because they're not getting the support from the practice with their involvement in fear-free. And so what I'm trying to do, and what I'll try to do today, is give some solid business reasons. I don't think we should have to have those, because I think the benefits to the animals should be enough. But I'm going to try to, provide you with some solid business reasons why it's worth pursuing fear-free, and that it can benefit your profitability and the value of your practice. And so for those of you who are practice owners, managers, leaders in your hospitals, hopefully this will be helpful. For those of you who aren't, but are having a hard time with your practice getting involved and engaged, I hope that I'll give you some talking points that you can take back to your leadership that can help encourage that process in your practice. So just super quick recap. Fear-free, our mission is to prevent and alleviate fear, anxiety, and stress in pets by inspiring and educating the people who care for them. So I hope that I can inspire you, at least in some small way, and I hope that you can take it back to some of your leaders and inspire them to encourage these changes. As most of you know, there are a number of levels of individual certification for fear-free. I'm not going to touch on all of those. But this is part of the process that we get to for practice certification, is to get each individual certified. And then through time and education, we advance in our knowledge and our levels of certification. What I mostly want to focus on today is the practice level of certification. So for those of you who don't know, the eligibility to become certified as a practice, it's not a super high bar, and that's important because I think a lot of practices could probably do this and maybe they don't realize that they can. So to begin with, in order to become a fear-free certified practice, you need to have 25% of your staff as certified professionals and have active memberships. That also means that, and part of that is that you have to have 100% of your management, which really generally means like 1 or 2 people, and then a majority of your veterinarians. You need to meet standards that cover a variety of categories that I have listed here. So there's physical and emotional well-being, client education, medical records, facility, community education, culture training and leadership, and patient observation. Much like AHA and the standards that they have, there are mandatory standards that you have to do in order to become certified. And then there are optional standards that, some of them you can meet or not meet. And then there's a self-assessment that you do online. Once you've met those standards, then you schedule an on-site visit, and that's where our CEVA professionals also help to implement those on-site visits. And those professionals are fantastic in terms of helping us make sure that we've met the standards, but also really helping us understand ways and that we can do things better. They helped us with figuring out like where to put diffusers and areas that maybe we weren't doing that. It's just a really good process to make sure that you're doing things in the best way you can. So once you become a fear-free certified practice, then the next year, in order to renew that, obviously there are fees involved. I'm going to talk about that in a second. But when you renew after a year, they require that 75% of your staff be certified, up from 25%. So the threshold to get in isn't real high. But once you're doing it, the whole point is to have this cultural change and to have everybody involved. So they want 100% of management, 100% of veterinarians, and 75% of your team to be certified. By the time you get to the second annual renewal, which we just did this spring, 100% of your team needs to be certified. And now that the only exception is people that maybe were just hired in the last 90 days. But other than that, it requires 100% of your team to be certified. And for those of you that are certified, you know that part of maintaining that certification, it's not just a one-time thing that you get the certification and now you're done. You have to obtain at least 4 credit hours per year in order to maintain that certification. So this essentially assures that everyone on your team is continuing to be engaged with Fear-Free. At the third annual renewal, this is where essentially it becomes just a renewal. Every 3 years, there will be another on-site visit, another self-assessment. You will continue to need to have 100% of the people certified. That's not hard to do once it becomes a cultural thing. Also, there are some significant financial benefits to practice certification. So as of today, I was just looking on the website at the fees. So to become individually certified, if there's just one of you in a practice, you're looking at $279 to start that process. The renewals are $99 a year. For larger practices that do more people at a time, there gets to be a pretty significant volume discount. This goes up even further than I have listed. It goes all the way down to $70 a person for our much larger practices. So there are benefits in having more people. But once you become practice certified, then it's just a fee for the whole practice. There's no more individual fees. And so it's $500 base fee and then $200 per FTE veterinarian. If you have a really, really big practice with more than 15 vets, it's just a flat fee of $3,500. The reason I bring that up is because I'm really trying to encourage practice certification. So just as an example, my practice has 33 employees. We actually have 8 doctors now. We just hired a new one, but it's actually only 5 FTEs. And so if I was paying for those 33 people at $99 a year for renewal, it would cost me $3,200 a year. But with the practice level certification, it's $1,500. And now everyone on my staff, anyone who comes in new on my staff, everyone has complete access to everything at Fear-Free. So they can take all the modules. Everything is basically, they're all members of Fear-Free, but we're just paying this one fee. So I just love the way that Fear-Free set this up, that the more people that get involved, the less expensive it gets. So there's some real clear price benefits to being a practice certified. So individual versus group. I applaud every single person who does this, and especially if you are a staff member who is trying to bring this into your practice. Kudos to you. Thank you for your leadership. It is so important to get people involved in this. That individual certification is so meaningful. There's so much that you learn, and it's great to be able to bring that into the practice. The more people you get certified in your practice, the more you start to have support, the more you start to be able to discuss different ways to implement some of these things, and you know, just more brains are better than one. And then we start to really get groupthink and lots of new and innovative ideas. But not only that, you get support. There's nothing worse than feeling like, you know, this is what the right thing to do for a pet is, and not having other people in the practice support that. When they're telling you, nope, you just need to push through and get this done. I don't care if that animal's upset, just put a muzzle on them, they need that nail trim. That's really disheartening. But if you have other people in the practice that say to you, wait a minute, I agree with you, this animal's getting stressed, we need to step back and try a different approach. Maybe we need to have them come back on a different day with some PVPs or whatever it might be. The whole point is you've got support for that, and that definitely makes you feel more comfortable in your job because it's team think instead of just individual. I think the huge benefits to Fear-Free come when you reach that tipping point. And that's going to be different in every practice, but when you get enough people involved, that it starts to become the status quo. It starts to become the thing that everybody is interested in doing, whether they've become certified or not. That's when it really starts to become part of the practice culture, and that's when the benefits become the greatest for everyone involved. So I hear this with AHA, I hear it with Fear Free. We already do it. What's the point of certification? You know, there's a real kind of feeling like, why do I need to go through this? Why do I need to pay the money? We already do that stuff. I find that just really isn't true. You know, unless somebody is holding you accountable, unless there are clear guidelines and processes that you follow, how do you know that you're doing everything that you can be doing? Fear-free certification really provides you with those processes and procedures. What I find is that the individual certification gives you a knowledge base. It helps you understand FAS. It helps you identify different levels of fear, anxiety, and stress. It helps you understand methods to help alleviate that. It helps you, you know, it's a knowledge base. But what practice certification does is it helps you implement that into your day-to-day program. I first learned about Fear-Free when I was speaking at AHA in 2017. And I was there as a speaker, I had extra time, and so I was looking for meetings to go to, and I saw Fear-Free on the program. I spent a half a day in the Fear-Free talks, and that was the first time I'd heard of it. I mean, it was pretty new at that time. I went back to my practice, and within 2 months, I had my entire staff Fear-Free certified. And so practice certification didn't even come along for another year after that. So my whole team, 100% of my team was Fear-Free certified a year before the practice certification even existed. And so what I can tell you is that there's a dramatic difference. Even though we were all invested, even though we all had become individually certified, we still had significant improvements in what we did once we became practice certified, because we had to learn how to incorporate that into our record keeping. We had to have processes in place to make sure that we were addressing the emotional well-being of the animal on a regular basis. And that's not part of the individual certification. There's a lot more about process and integration that happens at that practice certification level. And it made a big difference to our team, just from going from 100% of us certified to being practice certified. There was a definite difference and a definite improvement. So I'm going to switch gears a little bit. I'm going to put on my consulting hat a little bit more. I want to talk about brands. We don't think of our practice as a brand all that much, and yet it is. When our clients think of our practice name, they have an association with that company. And they have essentially a brand image. When I think about hospitals, I did a Google search for veterinary practice mission statement, and I have them on the screen, and you can see that these are all basically different ways of saying the exact same thing. Our mission is to provide the highest quality care. That's, you know, that's fundamentally it. Whether it's in a compassionate way, whatever it might be, but it's outstanding, it's highest quality, it's exemplary. This is what we all strive for. And that's fantastic, and we should. But how does that make us any different than any other? It's like saying, come to our practice, we love animals. Well, what veterinary practice in the country doesn't love animals? That does not distinguish you in any way, shape, or form from any other practice in town. So what makes your practice different? Who are you? What makes people connect with your business compared to any other practice? If we all have the same mission, how do we differentiate ourselves? So think of these common brands that you're all familiar with. Just a quick glance at these logos, and it should stir in you some sort of reaction. That reaction could be great, or it could be terrible. It might be that that's a brand that you have very negative association with, very positive association with, but one way or the other, it represents something to you. because you've interacted with that brand, maybe only through advertising, maybe in person. But one way or the other, you developed an image of these brands. So what's the brand image for your practice? When you think about where that image comes from, it comes from advertising, from the information that's out there, whether it's in print, whether it's the yellow pages, whether it's your website, social media, whatever it might be. There's this interaction that you have prior to being in the practice, and then there's your actual experience within the practice. Advertising creates the expectations, but experience solidifies that brand image. We can say that we want to provide the highest quality care, and that can be on everything that every piece of media, every piece of literature, everything that interacts with our clients. We can say over and over and over again that we have the highest quality care. And so that's their expectation when they come through the front door. But if they don't experience that when they're there, then that's not going to be the image that they have. Basically, our hospital brand image exists in the mind of our clients. We can push out what we want it to be, but every single client is going to perceive our image a little bit differently depending on their experience. The more consistent we are in the quality of our care, in the delivery of our care, the more clearly defined our brand will be. When you look at a picture of McDonald's logo or Starbucks, they're everywhere. If you go to a meeting across the country, remember back when we all flew on airplanes and went other places, you could go to a state all the way across the country and you could walk into Starbucks or you could walk into McDonald's and you basically know exactly what's going to be on the menu, what it's going to cost, what the quality is going to be, because there's that consistent brand. And that, again, whether you're connected to it or not, at least you know what it is. You know what to expect. What about people that come into your practice? Do they know what to expect? Are they getting a consistent level of care when they come into your practice? The more consistent it is, the more well-defined that will be. I don't know if anybody ever goes to despair.com. I'm a very sarcastic person, so I love that website. It's all demotivational posters instead of motivational posters. This one says consistency, it's only a virtue if you're not a screw up. So we're consistently hitting the target, but way off the bullseye. I put that in there just because consistency matters, good and bad. If somebody has a consistently negative experience at your practice, that's going to be your brand image as well, and it's going to be strong. And so the more we can maintain a good, high quality service, the more that's going to connect people. So why does it matter? The more consistent our client experience is with our hospital, the more loyal they're going to be to the hospital and the more they're going to connect with the hospital. And that's a key that I'm going to come back to here in a little bit, but connecting with the hospital, with the entire team, not just with individuals. If they have an inconsistent experience, they're going to be more likely to connect with just specific individuals, or they're going to be more likely to leave your practice. So we all know the practices where somebody loves Dr. Emily, but doesn't like the other doctors or doesn't get along with the staff or whatever it might be. And so for them, they're connected to Dr. Emily and they feel that the positive experience they have with her is worth it to overcome the other negative experiences they have at the hospital. And so that's great for Dr. Emily's ego. But in the long run, what happens for the practice if Dr. Emily leaves? And this is the concern as a practice owner. You want people connected to your whole team. You want people connected to your entire practice. If they are only connected to individual people, including yourself as the practice owner, then if you leave, you're going to be likely to have a lot of people leave with you. And that does not benefit your practice. And if you're selling your practice, that does not make it very valuable. So why am I talking about all this stuff? This is about fear-free. Well, what I love about fear-free is that it is system-wide. In a fear-free practice, it's everybody. It's from the first phone call to whoever checks them in, to the people in the room. It's everybody. By the time the doctor gets in there, they've already had 4 or 5 people that they've had experiences with. That experience is going to be different than at a non-fear-free hospital. And so it's also very tangible. It's easy to say, we're going to practice the highest quality care, but how do people recognize that? What does that even mean? You could be the greatest diagnostician in the world, but if you can't talk to people, they're not going to know what a great doctor you are. I think one of the best analogies I have is surgery. You could do the most amazing surgery. All the clients see is the stitches. If your suture line is not attractive, they're going to think that you didn't do a very good job. And so, you know, what you do and how you present it make a huge difference in how clients perceive the care. But what's great about fear-free is it's not just some notion. It's not something that we're just saying, oh, we're great. It's creating an entirely different patient experience. It's having that animal have a better experience every time they come in. And so that is something tangible that people see and say, wow, when I come into this hospital, I have a different experience than when I go into other hospitals. And that experience is system-wide. So it's not dependent on any specific person. And so what's great about that is that it really creates a strong brand for our hospitals. And that brand extends well beyond the individual people. It's the whole business that people connect with. So fear-free benefits many different stakeholders: our patients, their people companions, our staff, and our business. And this is where I really want to highlight the benefits of fear-free. I'm not going to spend much time on the benefit to pets, not because it's not important. In fact, because it's so important. It is the most important thing. But I don't think you're here today to be convinced about that. I think you already believe that, or you wouldn't be involved in fear-free. There are lots of other experts out there that can talk to you about the behavior benefits and all of those kinds of things. But there is no doubt, and I don't want to overlook, that the reason to do fear-free is because of the pets. Obviously, when our animals are happier, when they have decreased fear, anxiety, and stress, they have better visits. We also can get more accurate exams. So just from a physiologic standpoint, they have more normalized blood pressure, heart rate, glucose, those kinds of things. The other thing is we can actually get more done. You know, you're more likely to be able to draw blood. You're more likely to do the nail trim or those kinds of things if we're using fear-free approach. So moving on to the clients. A bad pet visit is a bad client visit. None of us like taking pets to the veterinary hospital if the pets hate it. It becomes our FAS goes up, let's face it. If their FAS is up, our FAS is up. The better their experience is, the happier they are when they come in, the happier the clients are going to be. Having that client experience is one of the best things that we can do to connect people with our hospital. The better their experience with us, the more likely they're going to come back. So looking back to the Bayer veterinary study back in 2014, they were looking at cats and cat utilization of our hospitals. And what they found is that actually more than 50% of cats were not receiving regular veterinary care. That's huge. I mean, that's a huge untapped market from a business perspective, and it's a huge deficit from a healthcare perspective. The fact that that many kitties are not getting the care that they need, all business aside, that's just a bad thing for cats. From a business perspective, this is a whole segment of our market that we're not reaching. They identified 4 major reasons why the majority of cat owners do not take their cats to the vet for routine care. Lack of knowledge, which is essentially like they don't understand why they need to go in. They don't understand the benefit of an exam, of a vaccination, of blood work, whatever it might be. So there's nothing to really push them or stimulate them to come in. The cat's resistance to travel and getting in a carrier is a big part of why they don't come in. and then a stressful experience at the hospital. And then finally, value. Well, value is the sum total of all the rest of it. They don't feel like they're getting a return for their investment. Well, the larger their investment is, the higher return they need. So think about that. The return is the healthcare benefits. So the getting an exam, getting a vaccination, you know, those kinds of things. That's the return on their investment. Well, but lack of knowledge, if they don't understand why they need to come in, then they don't perceive a real return on their investment. Well, what's their investment? Their investment is, besides paying for it, they have to get the cat in a carrier, they have to bring it into the hospital, they have to, you know, get through that exam. And if that barrier is bigger and bigger and bigger because they have an unhappy cat that scratches them, that bites them, that pees all over the carrier, whatever it might be, all of a sudden they're making this huge emotional investment to get their cat into the vet for something that they don't even perceive is worth it. And so a fear-free perspective, we can really address this because we can impact things like the resistance to the carrier and the travel to come in and the stressful experience in the veterinary clinic. The other part is also up to us to educate and let people know why it's important to bring them in. But fear-free can go a long way towards addressing, you know, why these kitties aren't coming into our hospitals. So what about our staff? There are huge benefits of fear-free certification to our staff. Job satisfaction. This to me is one of the biggest things. Why did we go into veterinary medicine? We love what we do. We love helping animals. We know survey after survey, nobody's in this job for the money. We're in it because we're passionate about what we do. Treating our patients better, recognizing their emotional well-being, addressing that emotional well-being, not pushing through, not making them more fearful, not making them more stressed. All of those things feed our heart. They make us happier. They make us more comfortable in our job. When we feel like we're doing the right thing for our patients, we enjoy our job a lot more than when we feel like we're being asked to put an animal in a situation that is inappropriate just to get the work done. That doesn't make us go home feeling good at the end of the day. We, you know, another whole set of topics in our profession is depression, stress, burnout, suicide. A lot of these things can stem from unhappiness in our jobs. So one piece of that pie, is certainly not the whole piece, but one piece of that pie is providing a work environment where we do right by our patients, and fear-free really helps us to do that. So if you love your job, are you going to stay in that job? Of course. There is so much more job retention if people enjoy what they do. So investing in our people, investing in our culture, having a practice that does the right thing is going to make people more inclined to stay in those jobs. Also, this team-based culture, there's no doubt that there's a real sense of pride in my practice with our team and what we do. We support each other and we're part of it together, and it makes us feel like we're more a part of a team instead of just a group of individuals working together. And that's just one more thing that makes people want to be a part of that and stay a part of that. And it also makes people a lot less likely to leave your practice for another practice in town. I've lost lots of employees over my 27 years at this practice. But I can honestly say that we don't lose people to other veterinary hospitals. We lose people because of other life reasons. We lose them to other professions. But I cannot remember, and certainly not since we've been fear-free, can I remember anyone leaving our practice to go to a different veterinary hospital. From a hiring perspective, having this kind of culture, having this kind of team-based approach, doing the right thing with our patients certainly helps attract more employees. I started giving this presentation back in 2018, and there was an article in today's Veterinary Business about the shortage of veterinarians, and they were talking about veterinarians having as many as 6 job offers within a 10-day period. COVID has certainly changed some things. There's more people unemployed and there's more people potentially available to hire, but we've had a real shortage of veterinarians, veterinary technicians in this profession. And being able to be more attractive to potential hires is certainly very, very good for our business. Last year, October, I had 4 resumes from veterinarians on my desk inquiring about the possibility of job openings at our practice. I had solicited none of them. I wasn't looking for a veterinarian. I didn't advertise for a veterinarian. I just had resumes on my desk. And this is at a time where I know through consulting that, you know, we work with a lot of practices that had been looking for a year or 2 to find a quality associate. So I don't know if that was how much fear-free impacted that, but certainly the overall culture of our practice and you know, the environment that we have, which is a big part, you know, of the fear-free, certainly had an impact. The other thing to understand too is that fear-free has done a fantastic job of getting into education. So if you are a vet tech student, a vet assistant student, a veterinary student, you have free access to fear-free certification. That's still a very passive thing. You still have to know about it. You have to get interested in it in order to take that step. But more and more, we're actually seeing schools that either require you on your own to become fear-free certified, as, you know, in order to be there, and others that are actually implementing fear-free into their curriculum. So we have a number of veterinary schools that are now implementing fear-free into the training process. So veterinarians, vet tech students, they are coming out of vet school fear-free certified. And who are they going to be looking for? Where are they going to want to go work? At a hospital that doesn't know what that is, that doesn't embrace that approach to care? Or are they going to be looking for those hospitals that have a fear-free culture? So it's just important to understand that while it takes a little while for these changes to happen, fear-free is becoming a standard of care in our industry. It's just like pain management. You know, 30 years ago, we talked about pain and we treated pain, but we didn't look at pain in every single animal. And we didn't have pain treatment plans for every animal. You know, now it's just standard of care. If you're not paying attention to pain, you're not practicing with the normal standard of care. And I firmly believe that fear-free is going to be that way. The number of people that are fear-free certified, especially even looking across the industries, when there's fear-free groomers and fear-free trainers, and you know, those all of that, and now fear-free is being implemented in a lot of commercial ways through literature, through Pet Finder, through Purina. There are just all kinds of resources where people are going to be exposed, and clients are going to come in expecting fear-free care. So if no other reason, you know, recognize that you might be the first now, but you're going to be the last if you don't embrace this soon. Workplace injuries and fear-free. So fear-free, the whole point of it is increased awareness and recognition of fear, anxiety, and stress. It doesn't mean that every animal is going to just walk in and immediately be easier to work with. The key, though, is that we're making every visit better. We're stopping when we need to stop. We're not pushing too hard. We're not making every experience worse so that they're even less likely to come back. We're trying to, through our emotional medical records and constant reassessment, we're trying to make changes so that every single visit gets better for those animals. The fact that we're looking at that stuff, the fact that we are aware when an animal is starting to escalate from an anxiety stress standpoint, when we can tell that they're getting closer to scratching, biting, all of those kinds of things, we're stopping and we're supporting each other in that we're not attempting 15 times to do the same thing if it's stressing the animal out. We attempt a couple of times and we stop and we re-evaluate. whether it's a different technique that we use today to still get it done, or whether it's having them back on a different day, maybe having some pharmaceuticals on board, whatever it might be, the bottom line is we're paying more attention. Well, when we pay more attention, guess what? We don't get bit and scratched as much as we used to. So there's a huge benefit to decreasing our workplace injuries as a result of fear-free. So to bring this all to the real tangible benefits of fear-free certification, it's all about differentiating your practice and creating value. My hamburger pictures are here for a purpose. We have a street in town where one end of the street, there's a nice restaurant called Blackwoods, and down on the other end of the street is McDonald's. And I talk to my staff about this all the time. You can get a burger at both places. You can get a burger at Blackwoods for $12, $13, $14. You can get a burger at McDonald's for what, $2, $3, maybe even $1. I promise you the people at Blackwoods don't sit down and eat their burger and then complain and say, oh my gosh, I could have got this for $1 down the road. At the same time, the people that go to McDonald's don't say, you know, this is a terrible value, I should be getting a much higher quality burger, right? I mean, they know what they're paying for, and you go to different places for different reasons. If you want a burger in 5 minutes, you better not go to Blackwoods because it's gonna take 45, but you're gonna get a higher quality meal, a better presentation, better surroundings, better service, and that creates that value. And so how do we create differentiation in our practice? How do we create that brand image? So differentiating their experience creates more value. Sitting down at that restaurant, having somebody take care of you instead of sitting in your car going through the drive-through, it's a very different type of value. The more you improve their experience, the more consistent and better that experience is, the more willing they're going to be to pay higher prices, but still feel like they're getting value. That's the important thing, is that it's worth it. It's not just that it costs more, but that it's worth it. The more, obviously, if you can increase prices, you increase your revenue. The happier people are, the more they're going to come back. They're going to bring in those cats that they didn't bring in before. How about that ear infection, where you recommend a recheck in 2 weeks? If that first visit was painful, fearful, stressful, it was all they could do to get their animal through that visit, are they going to come back for a recheck? Absolutely not. If we've improved that experience so that first one went well, are they going to come back and get that recheck? Yeah, they're a lot more likely to do that. Also, the better experience they have, the more unique and beneficial that experience is when they come to our hospital and say, wow, we've never had an experience like that. My animal is so much happier coming in here than they've been anywhere else. They tell their friends about that stuff. We all know people complain on social media, but guess what? When they have a really good, unique, high quality experience, they talk about that too. So the bottom line is if you can increase the number of visits and you can increase your prices, then you can dramatically increase your revenue. If you can increase job satisfaction, then you can increase job retention. The more you increase job retention, the less you have to spend advertising for people, going through the interview process, hiring people, training people. How long does it take to get a person fully trained, and not just to a minimum, but to a high level of performance in your practice? 6 months, a year, that costs you time and money every time you have to replace somebody. If you're a preferential employer, it's going to decrease your hiring costs. If you have fewer injuries, it's going to decrease lost time, which makes you more productive, and it's going to decrease your insurance premiums. Well, is that true? It absolutely is true. There are actually companies out there that are giving discounts for practices with fear-free professionals because they know that there is a tangible reduction in the number of workplace injuries when practices take that type of approach. There is more and more research being done right now. There are insurance companies that are looking at fear-free practices and their rate of injuries compared to non-fear-free practices. The problem is that we're so early in the fear-free practice life cycle that we don't have that data out yet. But when we do, it'll be great to have objective numbers that show that injuries were reduced by X%. But for now, just know that, hey, there are companies you can go to that'll actually reduce your insurance costs because they know that that benefit is there. So to sum it up, from a business standpoint, if you can increase your revenue and you can decrease your costs, what does that mean? It means you have a more profitable business. So from a veterinary ownership perspective, from a leader management perspective, there are tangible business benefits. Now, as they mentioned, I am a practice appraiser. Part of what I do, this is a picture of my practice, by the way, but part of what I do is I appraise practices that are being sold. And I'm not about to give you another whole webinar on practice valuation, but just to introduce you to the huge key concepts. The more profitable your practice is, the more valuable it is. The less risk there is, the more valuable it is. So profit is pretty easy. The more you have, the more valuable it is. And that's just because when somebody's buying your business, if they're buying a really profitable business, then that's more valuable to them because there's more money coming in than a less profitable business. But what's all this stuff about risk? Risk is the ability of a new owner to maintain that profit stream. So just because a practice has been wildly successful in the past, when you buy it, it doesn't mean that it's going to continue to be wildly successful. The things that made it successful have to be able to be sustained. They have to be able to transfer through that sale. So we call this the ability to transfer goodwill. Everything that we talked about earlier with brand image, with loyalty and all that kind of stuff, your reputation, all of that, how does that transfer from one owner to another? Well, it's sustainable if it isn't dependent upon the owner of the business. It's sustainable if it's a culture. And that's what Fear Free is all about. It's one of the things that I love about Fear Free is that it's a hospital-wide initiative. Every single person on the team believes in it, and there's an entire culture that our clients see. It doesn't matter who owns the practice. If that's the way that we practice, you could go through 15 owners, and as long as they have a consistent standard of care and client experience, clients aren't going to care. They're not going to leave when somebody leaves. But what about those other kind of practices that we talked about, where everybody loves one person but doesn't get that consistent quality of care from someone else? When that person leaves, clients leave with them. That's not sustainable goodwill. So it's really important, if the client experience and the practice brand image are derived from the entire team, then the risk to a new owner is low. If you have a fear-free practice and you've developed that entire culture-based system that improves our patient and client experience, that is not based on the individuals, it's based on the entire team. And you're going to end up with lower risk for the buyer, which ultimately means that your practice is going to be worth more when it comes time to sell. So I'm going to wrap this up and then we'll take some questions. But these, in summary, are all of the benefits that you can take back to your bosses, to your leaders, and say, here's why we should consider fear-free. The first one is the only one that should matter. It's better for the animals. If that isn't enough, then we've got a problem, because that should be the core of everything we do. Beyond that, from a business perspective, happier visits for our pets mean better visits for our clients. More frequent visits, increased perception of value, we can increase prices, we can reduce job turnover, reduce costs, improve our hiring. There's so much potential for increased revenue, increased profitability, and the bottom line is that you will develop a sustained competitive advantage. And so that's something that is just so important. It's not just for today, it's for the long run with the culture of your practice and the difference that your clients see when they come in. And I promise your practice owners that when it comes time to sell, it's going to be worth more. Just one other quick note before I sign off here. I've been studying corporate practice purchases for the last 3 years. I've been tracking all of the practices that corporations buy. We know that 12% of practices across the country are AHA certified, but guess what? 32% of the ones that AHA buy are AHA, or that corporations buy are AHA certified. We know that 3% of practices in this country are cat friendly, and yet corporations, 9% of them are cat friendly. We don't have enough data on fear-free practices yet for me to give you those statistics, but the point is, the practices that they're looking for, the high-performing practices that they know are going to succeed in the future, are the ones that have these cultures of excellence. And fear-free is absolutely a part of that. So that's all I have, and I'm more than willing to take questions. I think we still have about 10 minutes. My contact information is here. The first one is my consulting address. The second one is my practice address. And then we also have the website for my practice. Huge thanks to SIVA for allowing us to be here today. They are such big supporters of fear-free. We just couldn't do it without them.
Thank you so much, Dr. Hargrove. That was really excellent. And I'm thrilled to say that our first question comes from a veterinary student, which I just think it's fantastic that she's here. Yes. Her question is this: do you think you could send her more information or provide more information here on some schools that are incorporating fear-free into their curriculum and how they're doing that? What more could you say about how veterinary curricula is reflecting fear-free?
Yeah, I wish that I had more information right off the top of my head. Marty Becker always gives me this information every time we're together. and it's, you know, now there's 4 more schools, now there's 8 more schools. And like I say, he definitely has shared that information with me, but I haven't retained the specifics of which schools and how they've integrated it. Some of them do things like, okay, you've been accepted to vet school over the summer. Before we start in the fall, you need to get fear-free certified. So it's like, you know, just encouraging people to do it. Others are actually implementing it. But then, you know, the other part of it is a culture, like how are they teaching? So part of it is fear-free certification, but also part of it is just training in fear-free methods. I mean, when we're in vet school, we're learning how to handle animals. We're learning how to do exams. And so part of it is getting fundamental change at the school level where the school embraces fear-free techniques. And so students are learning FAS and proper handling and all of that as part of their education. And so that's our ultimate goal, is to just have it be part of the culture of the veterinary schools so that students are just simply learning that way. It's not just a matter of getting certified, it's a matter of this is the approach we should take to handling our animals.
We had a little bit of weigh-in from some of our attendees. Dr. Robin Downing mentioned that Colorado State University is requiring fear-free for all incoming vet students. Kate Thompson, I believe Dr. Kate Thompson said North Carolina State implements fear-free training for students. And I also know that the University of Florida is requiring fear-free certification. And I work with their shelter medicine program, which actively incorporates fear-free into their training, and all their professors, staff, are fear-free certified. So I think that it is really, I mean, there's many, many more. Like you, I've heard from Dr. Becker. He tirelessly travels the country, or he did before COVID shut that down, tirelessly traveled the country meeting with the deans of veterinary colleges. And I think that if that's something that people would like more information on, they can email wags@fearfreepets.com, and hopefully a little bit more detail about the schools in a more orderly fashion can be provided to you. Yeah, that would be great. That was our only question. So unless anyone else has anything to ask, we can give you back 5 minutes of your day, Dr. Hargrove. Does anyone else have anything they want to ask? I'm watching the chat window, not seeing anything, and I'm not seeing anything more come into Q&A.
Everyone else fell asleep.
No, I don't think so. You didn't have a single person leave, and everyone is there. So, but if by chance you did doze off at any point, the recording will be available, as I said before, at fearfreepets.com/webinars within a few days. We do have a team member out right now who may, so there may be a little delay on that, but I would assume by early next week it'll be there. So thank you so much for being with us, Dr. Hargrove, and for this great presentation. Thanks again to all of you for making time for this today, and to Siva for making this presentation possible. We ask that you all stay safe and make sure you care for yourselves as well as you care for everyone else. We will see you at our next webinar. Thanks, everybody.
Thank you.